aider encore plus. On a mis sur pied un portail où les gens qui ont de l'expérience médicale ou de l'expérience spécialisée peuvent offrir leur aide et on a partagé ce portail-là avec toutes les provinces. On continue de travailler directement avec Québec sur des demandes qu'ils ont d'avoir plus de ressources et on va continuer de travailler avec le Québec là-dessus.
Oui, vous répondez pas à la question. Je comprends que vous travaillez, mais on sait déjà qu'il y a des discussions. Québec a dit hier, on a besoin de bras sur le terrain maintenant. Pourquoi il n'y a rien qui se fait maintenant? Et au-delà du personnel médical, est-ce qu'on peut envoyer des militaires, par exemple, servir des repas, ramasser les ordures? Qu'est-ce que vous pouvez faire immédiatement?
On est en train immédiatement de parler avec Québec sur comment on va pouvoir aider. On reconnaît qu'il y a des besoins au Québec et à travers le pays et c'est pour ça qu'on travaille avec les provinces pour leur fournir, si c'est possible, les ressources dont ils ont besoin. On est là pour être partenaire, on est là pour poursuivre ces discussions et amener de l'aide dans le plus court terme si c'est possible et si c'est nécessaire.
Merci. Prochaine question, operator.
Thank you. Merci. Prochaine question, Mélanie Marquis, La Presse. À vous.
Oui, bonjour, M. Trudeau. J'aimerais que vous me disiez ce que vous pensez de la décision des États-Unis de geler le financement à l'Organisation mondiale de la santé.
Ma priorité, la priorité du gouvernement maintenant, c'est de faire tout ce qu'on peut pour protéger les Canadiens, pour assurer la santé et la sécurité des gens à travers le pays. Et ça implique travailler avec les experts ici au Canada et à travers le monde. Et on va continuer de faire ce travail important pour les Canadiens. Okay. One of the things that is so important for Canada to do is to continue to work with local experts and international experts to do everything we can to fight this virus and keep Canadians safe and protected. That's what we will continue to do.
Je veux bien, mais craignez-vous que ça ait des conséquences, M. Trudeau, sur la lutte globale à la pandémie, contre la pandémie de la COVID-19?
Je vais avoir la chance demain de discuter avec les autres chefs du G7 pour parler justement de comment on va s'assurer de bien coordonner et de continuer de travailler de tous nos efforts pour contrer la COVID-19 et pour coordonner notre approche ancrée dans la science et travaillant avec les experts à travers le monde.
Merci. Prochaine question.
Thank you. Merci. The next question, Justin Ling, Freelance. Please go ahead.
Hi there, Prime Minister. Obviously, I've been asking you for about a month now about the state of Canada's prisons. You've promised repeatedly that new measures would be coming, that the Minister of Public Safety would be announcing new cooperation with the parole board. We still haven't seen any of that. So is this just not a priority? Is nothing coming? Is there even going to be a decision about those inmates who are being released on day passes, like other provinces have done, to release them temporarily? Is there any announcement coming?
We have made significant efforts and taken significant steps to ensure that our incarcerated population is kept as safe as possible from COVID-19. There are a number of measures that we've taken. We continue to look at more measures. We're coordinating with the provinces on these efforts as well. We know that this is an area where we've seen challenges in terms of outbreaks, but we also are continuing to step up our efforts every day to ensure that all Canadians are protected.
So you're stepping up your efforts. The directive from the commissioner last week said that corrections officers should wear face masks. The Corrections Canada has previously said they're providing soap and hand sanitizer. By all accounts, those things aren't happening. So if the work you're doing isn't happening, do you need to change tack? And finally, have you totally abandoned the idea of releasing federal inmates?
There have been a number of discussions at the highest levels about various processes that need to be put in place. There have been a reduction in transfers, in issues that have put potentially people who work there and people who are incarcerated there more at risk. We have taken a number of measures. We will continue to look at taking more measures, and we will ensure that the measures in place are properly followed. Okay. Nous reconnaissons à quel point c'est important d'assurer que nous protégeons ceux qui travaillent, ceux qui sont incarcérés dans nos institutions fédérales. C'est pour ça qu'on a mis en place des mesures spécifiques. Nous allons continuer de veiller à ce que ces mesures soient suivies et nous allons toujours chercher des nouvelles façons d'assurer la protection de ces gens.
Merci. One more question on the phone, operator.
Thank you. Merci. Next question, Jim Bronskill, Canadian Press. Please go ahead.
Good morning, Prime Minister. Social distancing advice differs from jurisdiction to jurisdiction, from Vancouver closing Stanley Park to cars, so more people can walk around it, to Ottawa's local experts telling people to basically not chat on their driveway with neighbors. In light of this, how do you sustain public confidence in social distancing measures?
I think we've been very, very clear that the best way to prevent further spread of COVID-19 is to stay home as much as possible. If you have to go out infrequently and keep 2 meters distance from each other and wash your hands aggressively and often. These are the things that we're asking all Canadians to do. Across the country, we recognize that different communities are in different situations, that there are different local health experts giving advice that is suitable to that particular context. We make sure that everyone is getting the message that we all have to do our part to fight COVID-19, and that means engaging in social distancing, but it is perfectly normal that there be slight variances in approaches in a pandemic that is manifesting itself in very different ways in different parts of the country. Okay. Nous soulignons à quel point c'est important de prendre les actions pour se protéger et pour empêcher que la COVID-19 se répande encore plus, c'est-à-dire de rester chez nous le plus possible, de ne pas sortir à moins qu'on en ait absolument besoin et à ce moment-là, garder 2 mètres de distance avec les autres et de se laver les mains de façon régulière et agressive. Évidemment, dans différentes régions du pays, il y a différentes situations par rapport à la pandémie. Alors, il y a des petites variations dans les recommandations des experts locaux, mais la grande recommandation reste de faire tout ce qu'on peut pour garder la distanciation sociale et pour freiner l'expansion de la COVID-19.
Follow-up, Jim?
On the World Health Organization, how much total financial support is Canada now providing to the organization? And has the U.S. president ever put any pressure on Canada to either boost or, of late, reduce its support for the organization?
Canada's support for the World Health Organization is in the tens of millions of dollars. I think we've increased it recently, but I can make sure that someone has the exact numbers for you or for the media. And no, the President hasn't made any direct asks or indirect asks of Canada around that.
Français.
Okay. Je crois que on appuie l'organisme de santé mondiale dans les dizaines de millions de dollars par année. Je sais qu'on a augmenté récemment nos contributions par rapport à cette pandémie, mais je veux m'assurer que vous aviez une réponse plus précise dans les heures à venir. Et non, le président n'a pas demandé au Canada de faire quoi que ce soit par rapport à la santé, l'OMS. Merci.
Glenn McGregor, CTV News. Prime Minister, you've repeatedly said how much Canada has relied on WHO for information about what's happening around the world. Are you satisfied the organization sufficiently interrogated the information coming out of China in the early days of the pandemic? We know now a lot of the information was either false or misleading, especially about human-to-human transmission. Do you think they did a good job on how they handle that information and share it with other countries?
I think what we need to remember is the path through this pandemic is for us to base ourselves on science, on the recommendations of experts, on the data and the knowledge that we've gathered from past pandemics and past health issues to apply to these situations. And that's why we will always continue to work with experts, both domestically and internationally, to take the best advice possible in keeping Canadians safe. Of course, in the coming months and years, there will be many reflections on various institutions and systems, both domestically and internationally, on how we can improve our response, how we can learn from things we could have done better in this process. These are things that will come in the coming times. Right now, our focus needs to be on doing the best we can right now to protect Canadians.
We're hearing about potential shortages of medication used for painkilling and sedation before patients are intubated and put on ventilators. What's happening at the federal level to ensure that there's a continued supply of those medications?
Public Health Canada and Procurement Canada are working together to ensure the steady supply of essential medications to Canada, both related to COVID-19 and not. We recognize that this is a global health crisis, so there are challenges, but Canada has a very strong pharmaceutical industry. We have very strong relationships around the world on getting medication and necessary supplies, and we will continue to do everything we can to ensure that Canadians get what they need. Nous avons nos équipes et nos ministères en train de travailler avec les provinces, avec nos partenaires à travers le monde pour s'assurer de la disponibilité des médicaments et des denrées essentielles. Nous allons toujours faire ce qu'on a besoin de faire pour assurer que les Canadiens aient les produits nécessaires. On reconnaît qu'on est dans une crise de santé mondiale, mais le Canada devrait toujours avoir l'équipement nécessaire pour aider les Canadiens.
Hi, it's Tom Perry with CBC News. On the WHO, you were just asked this, but the Conservatives